Hey everyone. Today, I want to chat about a case of treating Parkinson's disease. You know, doctors come in all different skill levels, but most of us are pretty cautious when treating patients. This approach is generally good, but it can also be pretty stressful for us docs. Like, if you mess up cooking a meal, you can always just whip up another one, or if you're not too fussy, just eat it anyway. But it's different for doctors. If we get a diagnosis or treatment wrong, it's tough to get a second shot at fixing it. If a patient shows improvement after getting their meds and coming back for a checkup, that's great. But if there's no reaction, or if the improvement isn't obvious, we doctors start wondering, should we keep at it for another week, or try something totally new? And if there's still no clear effect at the next checkup, well, the stress just piles up. So, let's talk about our case for today. My friend's mom, in her 60s, was diagnosed with Parkinson's disease. It's a neurodegenerative disorder, and patients usually know quite a bit about their condition, so they don't have sky-high hopes. Her symptoms included hand tremors, slow movements, and a blank expression, classic Parkinson's stuff. She also had a dry mouth, cold hands and feet, dry stools, a red tongue without any coating, and a weak, thin pulse. From a traditional Chinese medicine angle, she was showing signs of both yin and yang deficiencies. How did we figure that out? First off, from her pulse, a weak, thin pulse indicates deficiency. Being an older lady, she was naturally more prone to not having enough yang energy. Plus, her cold extremities suggested yang deficiency, meaning her body wasn't warming up properly. The red tongue without coating and the thin pulse were classic signs of yin deficiency, indicating a lack of body fluids. Parkinson's really affects patients, and constipation can be particularly rough for them. Her constipation wasn't like the kind you get from overeating, but due to a lack of body fluids, which made it hard for her to go. It's like when there's not enough water in a river, and the boats can't move smoothly. After thinking it over, I decided to treat her with a method that nourishes both yin and yang, focusing on boosting yin fluids. I chose a combination of Rehmannia drink and a modified Shash in my dong soup. From my own experience and research, this approach seems to help with Parkinson's. It was early summer by then, and the weather was heating up. I suggested she take an extra 6 grams of American ginseng daily. It helps replenish yin and body fluids, and also cools you down a bit. I also recommended she practice Tai Chi every day. It's gentle and balancing, perfect for Parkinson's. Plus, I gave her some tips on lifestyle and diet, like regular bowel movements and using music effectively. 2 weeks later, she came back for a checkup, but there wasn't much change in her symptoms. I felt pretty confident about my diagnosis and treatment plan, so I told her to stick with the meds for another 2 weeks. She came back for a few more checkups, and each time, there wasn't much change. As a doctor, I know these degenerative diseases take time to show improvement, but you still hope to see some progress. Every time she came in, I was wondering if I should switch up the medication. But after each visit, feeling that the treatment was alright, I decided to stick it out a bit longer. More than 3 months in, I noticed some improvements. Her previously bare tongue started showing a thin coating, and her palms felt warm and a bit moist. The other symptoms hadn't changed much, but these signs meant the treatment was starting to work. Things shifted from a quantitative to a qualitative change, and her treatment started going more smoothly. Her bowel movements got better. They were still a bit of a struggle, but much more regular than before. And because she's super disciplined, she really took my advice to heart, practicing Tai Chi and making those lifestyle changes. Over a few months, though her disease wasn't cured, her constipation, slow movement, and fatigue improved noticeably, and her quality of life got a lot better. Over those months, we tweaked her treatment plan a bit here and there, but there weren't any major changes. My friend later told me he was a bit uneasy each time he picked up her prescription and saw not much had changed. He was worried I wasn't putting in enough effort. But on my end, as a doctor, I was always concerned. Besides diagnosing the condition, there's a lot of mental strain from not seeing immediate results. That's often tougher than the treatment itself and hard to talk about with patients, even if they're friends. Friends are friends, but some struggles are just for us to know. Alright, that's all I've got for today. Catch you later.